Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about another lipid parameter, that is the LPA, or lipoprotein small a, is one of the upcoming parameter which helps you to assess your cardiovascular risk. Usually this test is not done, but in the extended lipid profile, this test is also included along with your apolipoprotein A1, apolipoprotein B, and your LP little a. So you all know that this LP little a is closely related to your LDL. So both are almost similar, but only thing is that along with the ApoB, the LP little a also has the ApoA. So this has an extra passenger here, and this on its own, it makes this more atherogenic. Compared to LDL, this can be more atherogenic. So this is also a lipoprotein. That means it is also a boat. It's also a carrier which you will carry your cholesterol, triglyceride, etc. But now that it is a part of this LDL, that is your bad cholesterol, but along with that it is also having an extra ApoA, so that makes it still worst. So this lipoprotein little a has a tendency to attach to the blood vessels. It has a tendency to start atherosclerosis. So this high levels of LPA can affect around 1 in 5 people worldwide. So these were your lipoproteins, your chylomicron, VLDL, intermediate density lipoprotein, LDL, and your LPA and your HDL. So HDL was the good cholesterol and all these were your bad cholesterol. So or the non-HDL cholesterol. So were your triglyceride rich lipoprotein, your chylomicron, VLDL and IDL, and LDL and LPA are rich in your cholesterol compared to triglyceride. So now this LPA, it has a role in the cardiovascular disease. It by itself, not along with LDA, it can be an independent risk factor for your heart disease. How? See, it is basically what? It is basically your LDL. It is having your phospholipid structure. Along with that, it is having B100, that makes it LDL, plus the ApoA component. So along with this, what happens? It is having a tendency to cause accelerated atherosclerosis and also decreased fibrinolysis, and because of this there is increased chances of forming clots. So there is heart attack, stroke, peripheral vascular diseases, etc. And also the oxidized phospholipids of this have a tendency to cause your aortic stenosis or valvular interstitial cell calcification because of the oxidized phospholipids which are present here. So this can also lead to this stenosis, etc. So this LPA has proatherogenic as well as prothrombotic properties. Because it is proatherogenic, it puts you at a risk of developing your heart disease. Because it is prothrombotic, it puts you at a risk of developing stroke, peripheral vascular disease, etc. So this, it is proatherogenic because there are oxidized phospholipids. It helps in the firm cell formation. It causes endothelial dysfunction. It causes increased smooth muscle proliferation. It causes the increased chemo attraction of the monocytes, and it also causes the inflammation of the arterial wall. Whereas it also decreases the plasminogen activation, so that the thrombus, whatever is formed to break down, that activity is reduced. It will decrease the fibrinolysis, it will decrease the clot permeability, and it will increase the platelet response. That is why it is prothrombotic. The second important characteristic of this LPA is that it is a passed down through families and it has a gene involved with it. That means having an elevated LPA is almost entirely determined by the genes you inherit, specifically the LPA gene. Okay, so this LPA is transmitted genetically. Around 70 to 90% is genetically determined. Unfortunately, these lifestyle changes which we usually say for other diseases like cholesterol, triglyceride, HDL, etc., they are not able to prevent this increase lipoprotein from reducing. But yes, by doing lifestyle changes, we can reduce the risk of other factors. But per se, this, because it is associated with the genes, it is little difficult, and the other lifestyle changes may be less ineffective or less effective in reducing the LPA levels. This is mostly genetic, but certain conditions like diabetes, chronic kidney disease, post-menopause also can increase this LPA level in a few cases. And if a close family member is having high LPA, it is very important to get tested and encourage the other family members like parents, siblings, children, etc., to get this test done. So now why should I know my LPA? Because if there is increased level of this LPA, it can cause plaque buildup, it can narrow your blood vessels, it can reduce your blood flow. It can also cause inflammation, it can cause thrombosis, blood clotting. It is difficult for the clots to be broken down when your LPA levels are high. And because of this, your heart, your brain, your kidneys, your lungs, all of these can be affected. Okay, so LPA level of more than 50 milligram per deciliter or more than 125 nanomoles per liter will increase your heart risk of developing heart attack, stroke, peripheral arterial disease, aortic stenosis, etc. So do we do this LPA commonly? No. This is in a basic lipid profile, it is not included. But each individual at least once should get this LPA levels done. Because it is genetically determined, we need not do it again and again. But yes, at least once it has to be done. But mostly this is tested in people who have father, mother, sister, brother, if they are having a premature cardiovascular disease, if they are having a very high LDL cholesterol, if their LDLs are more than 190 milligram per deciliter, if there is family history or personal history of premature heart disease, or if they are having premature stroke, peripheral artery diseases, or aortic stenosis, if it is before 45 years in men and if it is before 55 years for a woman, we also would like to screen for this LPA. If there is a known family history of increased LPA levels, to diagnose familial hypercholesterolemia, we will do this LPA test. See, the patient may not have any symptoms, even his LDL levels may be normal, but his LPA levels can be elevated. So usually it is not included as a routine screening, but as I have told, in all these conditions doctors might order this. And also to see the treatment, how it is working, to take treatment decisions also, the doctors will order it sometimes. When the patient is put on cholesterol lowering medication, if the LDL is not reducing in spite of putting them on medications, doctor might still order LPA level to see whether it is because of your LPA levels. You can see here the LPA which is done. It should be less than 20 milligram per deciliter. So the normal is it should be below 20 milligram to 30 milligram per deciliter or below 75 nanomoles per liter. If the level is more than 50 milligram per deciliter, more than 125 nanomoles per liter, then it is thought to be elevated. So levels more than 50 milligram per deciliter is considered to be high. And yes, if your LPA levels are high, this increases the risk of developing heart attack, peripheral artery disease, stroke, etc. And this is a genetic risk factor for heart disease. So if your family member has a high LPA, it's important to encourage the other family members to get tested for this LPA, like parents, siblings, children, etc. So how can you reduce the LPA? As I've told you, this is around 70 to 80%. It is genetic, but other factors play a little role. But yes, to overall reduce your cardiovascular disease risk, you have to follow certain lifestyle modifications, etc., to reduce your risk of developing a heart disease, like taking the prescribed medicines as directed by your physician, not using tobacco products, eating heart healthy food, exercising regularly, maintaining a healthy weight, limiting alcohol use, getting enough sleep, etc. And also note that newer treatments are coming up to treat this increased level of LPA, and most of the new drugs whatever are coming, they are working by interfering with the RNA, the molecule that is copies and transfers this genetic instruction from the DNA, the cell's genetic blueprint. So whatever drugs are there nowadays, your lepodisiran or olpasiran, etc., these what they are doing, these are the RNA based drug, and they are effectively silencing the gene that makes this LPA in the liver cells. So trial has been going on, and these drugs have been tried. All these have been administered by injection every 1 to 6 months, and they have been shown that they reduce this LPA levels by around 80 to 100%. Side effects are minimal, short-lived, but still a longer trials have to be done, and we have to look for whether these drugs are really going to help or prevent these heart related problems which are related to increased LPA levels. This test is very underappreciated. But it is a very important factor. It is an independent risk factor for developing heart disease. Just because your LDL was normal, that doesn't mean your lipoprotein little a also will be normal. Your LDL might be normal, but your LPA might be very high. And it is genetic. This LPA levels are genetically determined. So yes, lifestyle factors, when you change them, they play a little role in reducing LPA, but yes, we have to follow or make changes in our lifestyle, because that reduces the overall risk of heart disease. But LP little a is related and it is a genetic disorder which causes increased level of this lipoprotein A, and 70 to 90% of the cases it is because of the changes in your LPA gene. People with overall LDL being normal can also have high lipoprotein little a, and it is always better that you get at least once your lipoprotein A number, because unlike LDL which rises with age and it is influenced by your diet, your exercise, this lipoprotein A largely is constant over a person's lifetime. So at least one time testing is sufficient for as a screening test. That was all about your LPA testing. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.